All right, hi everyone. Thank you all for joining. This is Power Sharing and Building Policy Through Engagement from Samuel Martin, CEO of SDMC. Did you want to start first, Lila, or
Oh yeah, could you go to the next slide for me?
oh, is it not?
We're still on slide 1, it says.
Oh, okay. Sorry.
I can confirm.
Okay. So sorry about that. Okay, we're having a malfunction. I'm so sorry about that, guys.
It's okay. I can go ahead and start talking. So my name's Dalilah Hampton. Currently I'm a community support coordinator, but I'm a former policy specialist at SDMC. I'm based currently in Louisiana, but a lot of my professional experience actually takes place in Washington State, and I am really excited to be here with you all today. That's my bio if you guys would like to go ahead and read it. Um, Yes, Pamela, we are on the next slide. Thank you.
Okay.
But now that we are on the next slide, I will go ahead and pass it off to my associate, Pamela, so she can go over her bio really quick.
Yeah, hi everyone. So I am a lived expert in the child welfare system. So I've been in foster care, group home care, and as well as an unaccompanied homeless youth. Right now I'm aspiring to earn my bachelor's in sociology with a minor in political science, so I can find a way to work with future youth who are in the child welfare system themselves. And I have a family myself, so I have three girls and a dear husband, and I enjoy singing and dancing. So, little fun facts about me. Okay.
There we go. So just we're going to jump right in. We would love to hear from all of you guys that are watching our presentation right now. So if you could just drop your name, location, organization, and or role in the chat. And maybe one song that you guys can't stop listening to right now. I know me personally, I've been on a really big Brazilian funk roll lately. So a lot of Mimosa 2000. But I would love to hear from you guys. Nice to meet you, Kordasha. Are there any songs that you guys have been listening to? We're glad to have you here, Shauna. Fate of Ophelia is a good one. I like that song.
Hmm.
Okay, it looks like we've got a lot of people from all over the country, which I'm really glad to see. I'm loving Bad Bunny. Thank you, Maria. That is such a good one. Anything Bad Bunny, honestly, I'm so glad he's going to be playing at the Super Bowl.
Mhm.
All right, we'll give you guys just a couple more minutes. Hi, Nikki. Deborah, nice to see you here. Renee, I'm sure Connecticut has some pretty great trees going on with all the leaves changing colors. Lots of Broadway. We love to hear it. Okay. Well, I just want to say thank you all for joining us for this presentation. It really does mean a lot that you're all here and willing to listen about our co-design process at SDMC. Yeah, I'll continue to look at the chat if anybody else wants to share. A lot of Bad Bunny hits. Okay, love to see it, guys. Thank you. Okay, we can move on to the next slide, but it is really good to see you all here. Thank you so much.
Did that change, Lila?
Yeah, you're good.
Okay, okay. All right, so as you can all see, this is part of our agenda, which I will have you briefly skim over because we will discuss all these.
We're
As
still on slide number 3. I'm so sorry.
oh, okay, still on slide 3.
Mhm.
Oh my gosh. I don't know why it's doing the like lag on this. Okay, I'm so sorry. It worked
There we
earlier and I don't know why. Okay. Here is okay, so here is our agenda. And you guys can briefly skim over it and see, and we'll go over it too as each slide progresses. So yep, we'll go over our goals, the team, and yeah, so we'll continue with the next slide right now.
Alrighty. Oh, yep. Okay, you're good to go.
Okay, so then this session, welcome. This session is centered around the invaluable insights and perspectives of individuals with direct lived experience in community engagement, service design, and co-design processes. Led by lived experts themselves, this session aims to illuminate the significance of their role and equip participants with practical strategies for effectively engaging and retaining lived experts in the service design process. Participants will gain a deeper understanding of the lived expert concept, learn tangible engagement and recruitment strategies while exploring activities showcasing the impact of power sharing, and delve into retention techniques. Some key takeaways from this will be a comprehensive understanding of lived expertise and its significance in community engagement and service design, practical strategies for effectively engaging, recruiting, and retaining lived experts, while also having tangible activities and approaches to implement within your own design initiatives, fostering inclusive and collaborative processes.
So together we are here so we can bridge the gap between incorporating lived experience and knowledge through access and opportunity. So our goal here today, we are really hoping to revolutionize lived expert engagement. We're going to do this through collaboration, innovation, and a commitment to inclusivity. So we strive to create a more equitable and inspiring world. So SDMC, we originally started as a lobbying and advocacy firm. We recognize that just passing bills through legislature every year, it just wasn't enough. And we've seen firsthand how limitations of the system, or what limitations are plaguing the system, and what it's going to take to really break out of that. So we believe that we have to support all parts of the process, including implementation, which is how the Co-Design Institute was born. So if you can see, SDMC is dedicated to amplifying the voices of those who have been marginalized and excluded from the legislative process. We support community leaders, advocates, and those working to dismantle oppressive systems by fostering collaboration and accessibility. So in other words, we make sure the people that are often left out at the table have a real seat, and we take part in shaping change. So this is born from lived experiences with systems like foster care and education. Our mission is to empower those directly affected to lead in rebuilding these systems for lasting impact. So the Co-Design Institute is a resource hub that puts people with lived experience at the center of program and policy creation. It provides tools, training, and connections to promote policies created by the people and not just for them. At its core, the Co-Design Institute emphasizes collaboration between stakeholders, traditional stakeholders, and those with lived experiences to create solutions that really work on a human level. So essentially, it's about giving people the tools and networks they need to shape policies that reflect their real life experiences. And we can go on to the next one. So these are just some of the states that we have implemented the Co-Design Institute in. Of course, obviously Washington State, that's where we're founded, but we've also done some work in California, Texas, Louisiana, which is where I'm currently at right now, Illinois, Ohio, New York. We've done some work in DC as well. We try to make a trip out there almost every year. And we've also done some work in Florida. So what is co-design? Co-design is an approach to designing with, not just for, people and communities. So this approach amplifies the voices and experiences of people closest to the needs addressed through an engagement or initiative. So in other words, Co-design ensures that people that are most affected by a project are at the center of shaping it and not just consulted after decisions are already made. It prioritizes relationships, building trust among all stakeholders, and uses participatory methods to guide the work. Co-design requires sharing power with people with lived experience across the entirety of the engagement or initiative or project, from determining the focus of exploration to designing and implementation, and then follow-up and evaluation. So simply put, it's about giving people authority in every single step, not just at the end or at the very beginning and taking it somewhere else, so that solutions are shaped by those who know about the issue best.
Alrighty, so um, influences that inspired this work. So we have three books on screen. First one is Beyond Sticky Notes, Comic Retcher, um, and then the other one's Design Social Change by Leslie Ann Noel, and the third one's Design Justice by Sasha Costanza Shoke. All three of these books, are, especially the Beyond Sticky Notes, were were the motivators for SDMC's work, and these models were all mainly international, and the goal was to bring it back to the States. Um, so I'm going to give a little preface on each book real quickly, be short and sweet. So Beyond Sticky Notes um, defines co-design as a transformative, community-centered method that moves beyond superficial consultation. Some key points from there is that it elevates lived experiences and goes beyond the workshop while prioritizing on one, power sharing, and the other is prioritizing relationships, using participatory means, and building capabilities. Now, as for design social change, it shifts the focus from creating products of services to actively challenging oppression and creating lasting societal changes. Such strategies like building critical awareness, such as knowing yourself and the system around you, to deepen your emotional um, intelligence by using emotions as fuel and envisioning equitable futures. So that could look like a dream or a prototype. As for the book Design Justice, key points from there should be that should be explicitly led by and for marginalized communities who are disproportionately burdened by the outcomes of traditional design. It focuses on centering marginalized groups while prioritizing impact over intentions, recognizing expertise, and dismantling the matrix of domination. So we have the definition of lived experience here. And so I'm going to read off the definition. Lived experience refers to the direct personal experiences and insights of individuals within a community, encompassing the daily realities, challenges, and perspectives, providing crucial input that ensures designs and solutions are relevant, effective, and grounded in actual needs. However, like for my example, I had said that I was a lived expert in the child welfare system because I was in foster care and so on. That doesn't mean that it only has to pertain to the child welfare system. So you could be a lived expert in many different things, such as have some, for example, individuals who have lived expertise because they had a disability have their own unique experiences that I won't be able to relate to and can't say that I have that lived experience.
Okay, so this part, I was hoping we could have like a little bit of a discussion. So I'm going to be monitoring the chat, but if you would like to just go off mute, I would love to hear from you guys. So you can do either or put your answers in the chat, or you can just speak out loud. And then I'll go over some things that SDMC has done to kind of engage with this work in terms of how we do this work, what we're doing, and then sharing some success stories we've had. So the first question is, how do you guys currently engage lived experts in your projects? And so again, don't be scared. You guys can put it in the chat, or you guys can just go off of mute really quick. Well,
Can
I give you
talk.
guys like, oh yeah, okay.
Okay. So are you wanting us to just share about the first one or all three?
Yeah, so we're gonna go through question by question, but I would love to hear you guys about how you guys engage lived experts. So we're just gonna do the first question for right now.
Well, I can say, okay, so my name is Jessie. I am currently it's a really cool role. It's called the Office of Consumer Affairs Administrator. I work with state government and I basically get to advocate on behalf of consumers. And I myself am a consumer. So lived experience is key. And a big thing that I've been doing, I've been in this role officially a year now as of yesterday. And a lot of what I'm doing is meeting other people that are experts who are lived experts. And I get to do this really thing. I'm replacing this council that existed before my time, but it still needed to exist in a certain way, but it was redundant and people weren't attending. So I've been not using, but utilizing, I mean, peers and advocates and people that I work with to help me build what we now have called the Lived Experience Leadership Network. We voted on a name, and I really have listened to people for many months about what was needed, what was missing, what was the real purpose, who needs to be here, and what are we actually solving? All these questions. And now we're really at this point where it's about bringing lived experience into every platform that we can, and it's not easy to do. I think it takes just sort of getting back up again when you make a mistake, um,
Mhm.
being redundant, like repeating things, like continuing to reintroduce yourself, continuing to network. And so we have 6 regions in Nebraska, and we're going every other month to each region to highlight those people in those communities doing this work already. And what do those counties needs? What specific needs are you able to help with that are unique? Because a lot of the work we do is siloed. And what I want to do is kind of try to bridge people to other people. You know, we don't always have the answers, but sometimes the answer is in someone else's hand. We just have to know they exist. And we don't always know that these people exist. So,
Absolutely. Thank you so much for sharing that, Jesse. And I think that it's great that you not only took the time to replace a council, but then you started bringing in peers that you already know. So you're engaging your community. And then from the very start, I mean, you're using your network to even vote on the name before you even get started on all of the processes that you're changing. So I really commend you for your work. And I see Stephanie has her hand up, so we would love to hear from you as well.
Well, hello. I am a parent support partner with FACT in St. Charles. It's family advocacy and community training. I actually had my own health journey, which I was not able to do a lot of work or actually work at all for a couple of years now. And so I had this experience as a parent that um, I was not able to find any support with. It's very challenging to parent while you are in a medical crisis. There's a lot of support for people with cancer, but there are many other conditions in which it's totally left out. In my work as a parent support partner, I have encountered other parents who are very similar. They're not able to engage with their children and play with their children. Teachers might not understand why they are not able to remember helping their children with homework and all these sorts of things. So was able to use these parents' live experiences and kind of unite them with mine. And I felt the need for support because there's a lot of isolation with it.
Mhm.
So um, I am starting a support group for parents who have chronic conditions, and it will be the first in the state. And it's parent led. So I'm asking the parents, like, do you want to facilitate this? Like, this is your time, instead of me being, I know I'm an employee, but you're the parent, you're who we serve. So incorporating them into the planning process, asking them what they would like to see. And then talking to my colleagues there's a couple of colleagues who also have had that experience, like fibromyalgia and lupus, things like that, and asking, do they want to join? So we're all kind of at this same level together. There's no, I'm not just your parent support partner. I'm learning from you as well
Mhm.
in your experiences. So that's currently what we're cooking up at FACT.
Yes, thank you so much for sharing that, Miss Stephanie, and thank you so much for being brave enough to, tell us about, your chronic condition. And I think most of all, empathy is like the cornerstone of this work. And so the fact that you were able to take a role that you had and like bring in parents that also struggled with the same thing that you were struggling with and create a community that you saw was lacking, like I think that's a really beautiful thing. And I also want to say thank you to all the people in the chat that are putting the way that they engage lived experts. So thank you, Katie, you as well, Cameron. I don't have your name, but Oklahoma Family Network. Thank you guys so much for sharing in the chat. I know you guys are all doing a lot of great work. And so my next question for you is question 2. So what challenges have you guys faced in recruiting lived experts? I can say for us personally at STMC, so something that we have struggled with is building trust. So we think it's important that lived experts trust that we will listen to their feedback and not only listen to it, but implement it when possible, where appropriate, and every chance that we get. We have faced a lot of practical barriers because we know that we're all human. And just because we ask for lived experts' input on something, it does not mean that we're entitled to it, right? And so it's both of our jobs, everyone's job, to really overcome things like transportation needs or maybe childcare needs and stuff like that. So there's a lot of practical barriers that when you're facilitating a conversation like this, you have to work with lived experts on. And then this kind of work can also be pretty emotionally draining. And so our top priority is to never add or touch on any existing traumas, and to create really a safe space. So I would love to hear how you guys are, what challenges you guys have faced, or how you guys are mitigating some of those as well. Yes. Thank you, Katie. Consistency in addressing concerns is really good. Yes. It can take a long time and it is easy to get bogged down on details because the process is so long. But I mean, the best thing that you can do is just try to push forward. We're going to touch on some stuff with extended foster care, which I worked on the policy side of in Washington. And I remember we tried for like 2 years to get certain aspects of it modified or changed and passed. So it can take a really long time, but at the end of the day, I mean, all the work that we're doing is really important. So I think it's really important to remember that. We're here to create community, create a safe space for people to talk, and create an impactful change. So yes, absolutely, Cheryl. Thank you for sharing that. Cheryl said, holding existing trauma experiences for our youth advocates and supervision while holding accountable the tasks of the role. It is very crucial in trust building. It is a marathon and not a sprint. You guys are so great in the chat. Yes. Thank you, Summer. Okay, so if any of you guys would like to share any successful strategies that you've used, I kind of compared those two, but it sounds like you guys have already done that. And again, I just want to commend you all. The cornerstone of this work is empathy, and it seems like you guys all have a lot of that. So thank you so much for all the work that you do. Pamela, if you would like to go to the next slide. All right, so fundamental principles. So these were what I would describe as like the foundation to the house of what is co-design. So first we've got healing and trust building. So we're going to acknowledge historical oppressions and our role in healing that in our communities and building trust. Second is power sharing. So we're going to find ways and opportunities to share power with those that we serve. And this is really fundamental to what we're going to be talking about today. For number 3, we've got prioritize relationships. So this means recognizing it's not always business as usual when it comes to lived experts, but it's about all of us as people. And we have to value the people side of the work that we're doing. Number 4 is participatory engagement. So finding ways to make the work and the design process interactive and engaging. Number 4 is building capacity. So this is creating the space to make sure everyone at the table has the information that they need to be able to effectively communicate and participate. And then number 6 is equity and justice lens. So that means we're going to be using this to continue to focus on the most marginalized communities. So we're going to be moving on to number 15, and we do have a little activity for you. So I'm going to be dropping something in the chat really quick. Give me one moment. Okay, so what this is the continuum of engagement and, right, so the continuum of engagement is a tool that we made to help organizations find out where they currently stand on their engagement with lived experts. This tool is not meant to make anyone at any organization feel bad, but it is designed to help you. So you've got a copy of this slide, and Pamela, you can go on to the next one. Yep, and you've got a copy of this. That is what I just sent in the chat. I would love for you guys to all download it, take a look. So when you're looking at this part of the continuum, you'll see a lot of the greater details about what each part of the continuum might look like. So what an organization might do or what an organization might say. I'm going to go ahead and hand it off to Pamela for this part.
All right, so we are going to, I think we're gonna go over here and then we'll do that. Sorry. Okay, so we're gonna break you out into breakout rooms, and what the goal is to go over with your groups and attempt to guess where your scenarios will be fitting on the the continuum engagement PDFs that we sent you. And so you'll be given 3 scenarios and you'll just read over them. I don't know if are we coming back to each breakout session? Sorry, or are they just gonna sit for about 5-10 minutes and then read over?
We can let you guys sit for about 5 or 10 minutes. Pamela, if you could send the scenarios into the chat for me. I did have them pulled up, but it looks like I lost them on accident.
Oh, okay. Yes, I can give the scenarios.
Let me see.
I'm gonna stop sharing for a second because it will be in my emails. So I'm gonna have
Got
to
you. Sorry about this, guys. But yes, we are going to be doing a really brief activity, the continuum of engagement. So what we're basically going to be doing is giving you 3 scenarios, and then we'll put you in your breakout rooms. It'll be like maybe I would say maybe 3 to 5 people, and then you'll read the scenario, and then you'll just decide where you guys think it falls on that spectrum or scale that we just sent out to you. So if you guys could all, download the continuum of engagement that I sent in the chat, and we can go ahead and get started in just a second. Let me see if I can help.
I had it pulled up too, and then I took it down. Sorry, guys. Oh, that's not it. Okay. Continuum engagement. No, that's not it.
Let me see.
Okay. Well, I only have it on the slides of what it is. So what I could do is I could.
You can copy it off of the slides.
Yeah, that's what I was thinking.
Mm-hmm.
Okay. Okay. All right, so scenario 1 will be sent in this chat right now.
Alrighty, we're sending scenario 2 right now as well.
And here comes scenario 3. So yeah, if you guys could all find a way to save them, like, take a picture if that's easier so you don't have to write out.
You can definitely copy them, paste them into the chat
copy
if you need to.
paste.
Yeah, we'll also be like hopping around to all of the breakout rooms. So if you guys need a refresher on what the scenarios are, again, this should take about 10 to 15 minutes. You guys will go through, read the scenario, and come to a consensus on where you guys think it will lie. So I'll put you guys into breakout rooms now. And we've got about 36. So we're gonna do.
And I'll go back to screen sharing here.
Okay, there we go. Okay, I'm sending you guys into your breakout rooms now.
Do you want me to put a timer?
Yes.
Okay. Do you want me to go to the breakout room? Because you sent me.
We're all gonna go to the breakout room, so we're gonna like hop around.
Okay. See how it's all going. Okay.
Mm-hmm.
Sounds good. Okay, I'm joining this one right now.
Hey, can someone put me back in a room? Hello. Can someone put me back in a room, please?
All right, how's everybody doing here?
I don't think anyone has started.
Uh-oh, okay.
I
Let me-
thought I kicked myself out of my other group and now I'm here, but I haven't heard anyone talking.
Okay, would you like me to move you to a new breakout room?
Sure, unless someone here wants to collaborate.
Okay, here, I'm gonna move you into group number 2 if I can do that.
Thanks, Dalilah.
Mhm. Okay, there we go. You should be good to go. Join group 3.
Thanks.
Yeah.
I
It
don't see
didn't.
the prompt. Yeah.
Okay, let me see. Hmm.
Wait, okay, let me see. Oh,
Okay, there we go. Did you get it? I think that means she got it. Okay.
Me back to the main room again. It keeps kicking
Interesting.
me out. Okay, I'm going to try to rejoin room 5.
Okay.
I'll try again.
Okay. Thank you so much. I'm sorry about that.
No, it's not. I don't think it's your fault. Let's see. Oh, no, it's not.
There we go.
Okay. And then are these other individuals having trouble getting into a breakout?
I think maybe they just didn't realize we put the prompt up and they didn't get a chance to join. Jenny said that nobody was talking in this chat yet, so we can
Okay.
just hang out. I think this is number 5, I believe. I have no idea which group we're in, but it looks like everybody's talking on my end, so that looks really cool.
Okay.
Okay.
I think, can you look at 6? I just told them the instructions and then left.
Oh, what about 6?
Oh, I was just making sure they were talking because I had left and
Oh yeah. They're talking. Every group right now is talking, mic off.
okay.
Nobody's got cameras on, but that's okay. I mean, we're all human.
Yeah. Okay, so
Actually,
we
a
have
couple
about
people have camera on. Oh wait, that's
cool.
us.
Cool. They have about 4 minutes left.
Okay.
This is going a lot by we're going a lot by smoother this time around today.
Yes.
I am gonna be looking down quite a bit because I have to have my notes up. There's no way I can do this.
You're all good. And also, if you just don't want to have your camera on, that's also okay as well.
I
Whatever you
might,
want to do.
but I might have it just because I've had people at presentations look down at notes and is
Yeah,
what.
yeah. I mean, I'm doing it right now just so I can keep track of what slide actually are we on. We should be on the slide before
All right,
like
this
17,
one,
I believe.
16.
16. Okay, cool.
And then when they come back, we'll go through each scenario.
Okay.
That is so weird that it was working for us earlier and then it wasn't like switching. Well, when I practiced earlier with my friend and she was like, yeah, the slides are
It looks
moving.
good.
Yeah, so I don't know what happened, but that's okay.
Mm-hmm. That group's doing good. Group number 6. I think they might have already gone through the scenarios. Nobody's talking anymore, so I think they might be good. Do you want to, how much time left on the timer?
3 minutes. So I'm
So
giving
how
about
about maybe at like 10 to 10, we can come back as a group.
okay. I do have to do one thing, which is
Yeah,
uh,
take. Nikki, are you there? Yeah, I didn't think so. And we're in here with Jeremy, so. Let me know when you're good to go and I'll close those breakout rooms for us.
okay. I am close to being done. I'm just copying and pasting something and then we're all good.
Okay.
I'll get that.
And then are you ready to go back onto Canva to screen share? Yeah.
Yes.
Cool.
Yeah.
All right, I'm gonna close those breakout rooms.
Okay, is everyone back in?
No, we're still waiting on just a few people.
Okay. Oh, wait a second.
Mhm. Group number 5, they're still discussing. Okay, group number 5. Alrighty, in 3 seconds, we're gonna have everybody back into our main room.
Okay.
Here we go. Alrighty, I think we're at 32 of 46 it was, 33. Waiting on a few more people to come back from their breakout room.
Thank you for the tool.
Mhm.
It made it easy.
Yes. Alrighty, so I think we can go ahead and get started. So, Pamela, go ahead and take it away.
Yeah. Yeah. Okay. So let's begin by going over scenario number 1. If one person from each group would like to share either through chat or, going off of the mute and explain where they think their answers landed on the tool. And yeah, let's start debriefing. So does anyone want to go first? And please state what group you're in.
And I can go ahead and read the scenario out for you guys just really quick. So a national nonprofit organization focused on health and wellness is looking to implement wellness opportunities in underserved communities. They plan to expand into King County, developing parks, walking tracks, outdoor fitness equipment, and exercise classes. To start, they host a series of focus groups in Seattle to hear community feedback. The information collected is reviewed internally and decisions are made without further community involvement. No follow-up communication is shared with participants. Development and delivery of a variety of different programming. Okay, so you guys got to take it away.
Does anyone in group 1 want to share?
I can go. I was in group 6, but I'll
Okay.
do it. So my name is Shayla. I'm a social work intern, and group 1, scenario 1 is gives me like placid, like complicit. It's kind of like, okay, we heard you. Here you go.
Yep. Okay, complicit. Alrighty, are there any other groups that would like to share? And thank you so much, Shayla, for sharing what you guys' group came up with.
This is Cheryl with Family Strong in Denver.
Mhm.
We rated this one as placate
Okay.
because it
And
kind of
what?
presented the image like they were including people, but didn't no follow through or actual involvement with decision making. I can't remember what group I was in, what number. I don't think I looked at
Yeah.
at that.
That is all good. And I see, Cameron, you also said that scenario number 1 was placate as well. So we got 2 placates, some complicit. Is there anybody else? Even if you don't remember your group, that's okay. You can go ahead and just share what you personally thought it was or what your team might have thought it was.
I'm also involved because they did use it. So it's not, they did actually use the feedback that they asked for. So it was more than they just collected it. They used it, even though they didn't reply. So they didn't give them the feedback of the use, but they did use it. And so we moved that and looked at as involved.
Involved. Okay, that's a good one. All right, so I think what we're seeing here is that, we've got some complicits, we've got some placates, we've got involved. So I think the purpose of this activity is to show that, like, depending on the person or the perspective, it can kind of change what level of engagement you're at. But Pamela, if you want to move on to scenario number 2.
Yeah. Scenario 2. So, a small startup nonprofit in Milwaukee was created by a few Black and Brown community members in response to growing housing needs. They began by hosting a series of small town halls to better understand the priorities of local residents. Based on these conversations, they co-developed a vision and program structure with residents and invite several to sit on an advisory board to guide the nonprofit's first year of programs and services. So, yep, again, if you all want to share what you all thought and where it was placed on the tool.
Again, we looked at this one as more as collaborate because it is one where they did they took it further. They actually gave them feedback with what they did. Also, they did co-develop. It says they co-developed a vision program structure with residents. So they it was almost at the level of co-creation, but definitely was collaborate.
Anybody else?
We said co-create, collaborate in the chat. Okay.
I was
Nice.
just gonna ask what the chat was saying.
A lot of collaborate and co-creation, I think.
Great. Okay.
Yeah.
Okay, let's go on to the third scenario. So scenario 3, a large, well-established youth serving organization is seeing declining enrollment from communities of color in Los Angeles. To address this, they send out a survey to families and youth to gather input on program preferences. After receiving 300 responses, they develop a new program strategy internally. When launching the new programs, they send out an email update thanking people for their feedback. Any thoughts on this one?
Okay, another placate for this one.
Okay.
Placate and involve, okay.
Mm.
A survey with a hands-off approach, but appreciative they incorporated the responses and thanked them for their feedback. If they continue to build on this relationship, it could be involve. Okay, and another involve, yeah.
Okay. We'll take a couple more answers if you want to share.
Involve and collaborate.
Okay. Okay. Was there any new ones, Lila, or am I good to?
We've actually got an involve and a placate.
Okay.
Yeah, so I think that one's pretty interesting too. Involve, they said, designed a program without any further input. Thank you, Jeannie, for that as well. Yeah.
How would you have rated those?
I'm sorry, what was that?
How would you have rated it?
So that's the thing with this, activity is actually, go ahead, Pamela, I'll let you explain it.
Oh, okay. Okay. So what I was gonna say was, yeah, so as you all were trying to decide where everything was gonna fall in line for the spots on the tool, you might have noticed while reading the scenarios that it could land on more than one. And that's meant to it's actually a good thing and it's okay. And because it's meant to show the fluidity that can occur in real life, right? So sometimes, like for example, sometimes they might be a little involved, but then also a little collaborative. So and there was another thing I hope you all were able to pick up on as well, is that so, when given the scenarios, did it feel like you're lacking information? Um, just seeing this right now, I'm like, there seems to be more questions that arise, and that brings to the attention of our communities are often not given all the information, and it's up to us to be transparent and create feedback loops. So ensuring they know where their survey data goes and inform them how they use the recommendations. Um, and yeah, so those were the key points on this, and thank you all for doing the continuum matching game. I hope it was helpful.
Yeah, so it can fall into a bunch of different categories for this one. So on to 20. Oh, there we go. So understanding lived expertise. So why lived experts can lead. So people with lived experience have firsthand knowledge of systems or issues at hand, which makes them uniquely positioned to guide solutions effectively. Recruiting lived experts. So it's important to identify and bring in individuals whose experiences are relevant and ensure diverse and a representative group. So our approach at STMC, we like to focus on creating inclusive, supporting spaces where lived experts are treated as equal partners in shaping programs and policies, and engaging lived experts effectively and intentionally. So engagement should be purposeful, thoughtful, and respectful, giving experts real opportunities to contribute at every single stage of the process.
All right, so I will give you guys about a minute to read over these, and then I will cover the main concepts of all these, but if you take a time to just read through them. Okay. I'm gonna, you can continue to read through them as I'm talking, but so I'm gonna cover the authenticity and credibility. To reiterate these concepts, my experiences in the child welfare system gave me the lived expertise to develop authentic, impactful strategies for system improvement, such as like suggesting better suited training methods for support systems that want to build stronger relationships with youth and young adults. Now, personally, I don't think I would have been able to give that authentic, um, those authentic, incredible suggestions if I had not been in foster care or been in group home or it was an unaccompanied homeless youth. And so I want to touch base both on empathy and understanding while also touching base on empowerment inclusion. Um, Considering lived experts have particular emotions about past challenges allows for more elaborative and cooperative outcomes that positively impact others. For example, I tend to notice that we have this mentality that the system has negatively impacted us or even failed us. And we get into this mindset that we don't want this to ever happen to other youth and young adults. So we decide to make a difference by using our experiences as a driver for a change. Um, and for innovative solution focus, the most meaningful and effective system interventions emerge from those with lived expertise. Relying on external perspectives, even from highly credentialed professionals, will only produce surface level changes, and real transformation requires the intimate knowledge of those who navigated the system. So I think of it as like when you hire people based off of like their higher education, right? They have like a master's, but they don't have any lived expertise. It's like a person outside of box looking in, whereas a person who's had lived experience and might not have all the credentials, they have more of that firsthand knowledge than somebody who spent years learning about it because they have that firsthand experience. And then Lila, I think this one's is this me or is this you? I'm sorry. I forget.
Yeah.
Okay, is this me? Okay, sorry guys. Okay, so recruiting lived experts. So so the practical recruitment strategies such as identifying and reaching out to potential lived experts while utilizing community networks. Some best practices are ensuring diverse representation, offering appropriate incentives, be clear about the commitment, and discuss scope of work and time commitment. Ensure they know when and how much will be compensated. So I'm going to heavily emphasize on the compensation piece, only just because I have done projects where I have not been compensated, and it it definitely it made me feel like I was used. So I recommend that we, we compensate all lived experts. And if we think about it this way, we compensate physicians and specialists for their acquired expertise, often through systems like insurance or even like out of pocket, right? It is fundamentally a matter of equity to compensate lived experts for their time and effort in co-designing meaningful change. Because as I was saying, there are times where I felt used for my lived experience when I didn't feel like I was compensated. And I don't think we would ever want to intentionally make someone feel used. And so, high, again, big emphasis, compensate when you can. Oh, it's not changing. No, no, no. Is it okay? This one.
There we go. So our approach at SDMC, so we recognize the significance of involving experts with firsthand experience in a purposeful and strategic manner. We aim to ensure that our approach is both grounded in reality and enriched by practical insights.
All right, so engaging lived experts effectively and intentionally. First one says create safe and respectful spaces. So ensuring that the environment in which lived experts share their experiences is safe, respectful, inclusive. A good example of that I notice in a lot of my co-design spaces is um, we tend to we tend to create a group ground house rule, and that could look at something like we are going to use trigger warnings before saying any sensitive topics. And so that look like trigger warning and then talking about the sensitive topic. And I really enjoy that because people, that builds trust among each other. And we are the ones building the house rules. We're the ones in the space, we're sharing, we're being vulnerable, and I like it better than compared to when the person who's in charge of the project is creating the rules because again, we get to be a part of the whole process and that also incorporates the fundamentals such as house rules. And then uh involve lived experts in all stages of the process and decision making so that can like integrate lived experts into the entire process from planning to implementation and evaluation. I want to make emphasis on this as well because I've done projects where I was lacking that involvement and there was a lack of transparency, and it really hurt because I had shared my lived experiences and now I don't have any updates of where my story is going, how it's being used, and so when I had joined SDMC and DCYF's co-design session, the people who were in charge at the time did such a wonderful job at sending emails. They had even sent me messages because I gave consent with my number, and so I was at the whole time I was given great information and feedback on what's going on, and they weren't all good news or bad news, and that felt good to me because I knew that my time was being respected and that I also was being respected as a person and knowing that my story isn't just being used in any way other than what it was meant to be. And then provide fair compensation and recognition, as I had stated earlier and made a big deal about it. I also think it's essential to compensate lived experts, but it's like you have to also be pay accordingly. Sorry, you got to make sure that you're not underpaying because again, that's another form of making somebody feel like they're used when you're underpaying. And so I highly recommend researching how much lived experts should be paid and communicating with them for fair compensation. So for example, when I had joined DCYF's oversight board committee, the people who had worked at the governor's office looked and researched at the Washington State's Office of Equity of how much lived experts get paid through projects. And then they had communicated with me and we came to conclusion of yes, that's fair pay of $57 per hour because that's how much everyone else gets paid. But that came in on their part of doing the research and making sure that not only was I getting paid, but I was also getting paid at a fair amount for my work. Oh man, it's not changing again. Sorry. Okay. Okay, so we will be doing the power of engagement activity. We will be breaking into small groups, and so there'll be about 2 to 4 people in each one. And you guys, do you have the slides for the questions or no? I forgot.
We don't really need the slides for the questions. I'm gonna put it into the chat for you guys. So
Okay,
if
perfect.
you wanna go on to the next slide for me.
Yep. So we're gonna be looking over these questions, cat or dogs, and you guys are all gonna come in and decide what the group thinks you guys like more, cat or dogs, right? Pretty simple.
Yep. We're going to be in breakout rooms for about 2 minutes, just really quick consensus. Is your group choosing cats or is your group choosing dogs? We'll come back, we'll go over your answers, and then we'll go on to the next scenario. So I will go ahead and do breakout rooms again.
Perfect.
All right, so all your rooms should be open.
You want me to join or just stay right here?
You don't have to join. Yeah.
Okay. How much time do we have left?
I think we were supposed to end at 2:30, but I mean, we plan to go until 2:40, 2:45, right?
Yeah, okay. We're getting there. Okay.
Mm-hmm.
I want to make sure you get to work on time.
Oh, it's okay.
Okay. I'm sorry, that picture of that cat is just so funny.
It looks so mean. Oh my gosh.
Give them another minute here and then they can come back.
Mm-hmm.
Thanks for doing the breakout rooms. I do
Mm-hmm.
not know how to function that.
Oh, it looks like we have a few people in our breakout room. Hi, Andrew, Ashley, Danielle. How are you guys doing?
Hi. Sorry, I just see the presentation.
Okay, we're gonna give everybody maybe like 1 more minute and then we can come back.
How many breakout rooms did you do? Just out of curiosity.
It didn't let me change it from the first time, so we've got like 5 or 6 people per
Oh,
breakout room. Oh, it's okay. So we're gonna close the breakout rooms now.
okay, no worries.
And you can go ahead and choose whichever breakout room you want to do.
Oh, there was actually 8.
Yeah, so I would choose between 2 and 8. Choose one. Yeah.
I'm gonna do 3. Just
Okay.
because I have 3 kids.
There we go.
Okay.
All right, looks like everybody's coming back to us. Looks like we're running a little short on time, actually. So
Okay. We'll go over this a little bit quicker then. Okay, so could
we've
someone
only got, I think we've only got 15 back so far. We're still waiting on a few more to come.
Oh, okay.
I think. Yep. Breakout rooms close in 10 seconds, so I'll just give it a few more.
Okay. Sounds good.
Okay, everybody should be back in the group. 29. Okay.
Okay.
There we
All
go.
right. So yeah, thank you all for doing this. But I'm gonna select one group. I'm gonna do group 3. Would one of you guys, or would you all like to report on what you have decided as a group, whether you are cat or dogs? Oh, and another question is, could you tell me if it was hard to decide? Is there someone in the chat? I just can't see.
Someone remembers their group number because I don't.
Okay.
So I think we were group 8
Group
and
8?
we picked dogs. And it wasn't hard
Okay.
for us to choose. I think we were all dog lovers.
Okay.
Got you. Okay. So group 8 decided dogs, but in the interest of time, I think we are just gonna try to speed through this one. If Pamela, you want to go ahead?
Yep. We're gonna go to the next question here. Okay, sunrise or sunset?
Yep. So we're putting you back in breakout rooms. 2 minutes again. Yeah, you'll have 2 minutes to decide if you guys like sunrise and sunsets, and if you could, just try to pay attention to your breakout room. And then who answered cats or dogs? Was that you,
Group 8.
Asia?
Group
Okay, thank you. Okay, you guys are going back in your breakout rooms now.
Sorry, who was it that answered? I'm just making note.
Let me see. Group, yeah, chat room 8.
Chat room 8.
So Nasia, family partner cares.
Okay. Would you mind calling on that person and come back?
Yeah.
I am gonna have to get some water. I will be right back. My throat is
Yeah, do your thing.
Okay. Is everyone back?
I'm closing the room now. Okay. I'll go ahead and do this part. All right, it looks like everyone is slowly trickling back in. So we're just gonna go ahead and go with the last person that answered. It was group 8, so that would be Nasia, Cares, Corinne, or Oklahoma Family Network. Would either of you guys like to determine which one did you guys choose for sunrise or sunset?
I think our group, we didn't really settle on one because it was kind of hard. Everyone liked both.
Really? Okay. So how about we go with well, what would you say, Nasia, if you had to pick sunrise or sunset?
If I had to pick, it would be a sunset, just because I feel like that is just like another, like, just to know like we completed another successful day, like we made it through the day and it's ending.
Okay.
There will be another one.
Yeah, so would you say this was a pretty difficult decision for you guys to come to, like even as a group?
As a group, it was probably a bit difficult to like land on one, but for
Yeah.
like me personally, I feel like it was like I already knew sunset.
Got you. Okay,
Yeah.
so in like the interest of time, we think we were already going like 11 minutes over. Hopefully, we can all just kind of decide like as a total group census that sunsets, they are probably the better out of the two as opposed to sunrise, because it means the end of a day. So yeah, you guys are okay with choosing sunsets over sunrises? If you could just give me a little reaction in the chat, maybe a thumbs up. Yep, sunsets are good. Everybody's choosing sunsets. Okay, cool. All right. We're in consensus. We're going to choose sunset.
Okay, so we have a third one, which is what is the best season? We got winter,
So,
fall, spring, and summer.
okay, we're going to do another 2-minute breakout room and then we'll pull you guys back and then we'll determine which one is the best season.
I'll be back again. Drink a little bit more water and see if it'll help if I take like a cough drop.
Yeah. All right, everyone, welcome back from our last breakout room. So we're just gonna get started. We can just start with group 8 again. So that would be Nasia, Corinne, or Oklahoma Family Network. What did you guys decide as the best season?
I think our best season would have to be spring, was what we chose.
Spring. All right, I like that answer. Spring is very beautiful, but again, in the interest of time, are we able to just come to a consensus that we're all in agreement with spring being the best?
Fall was our second one.
Fall was the second one. Okay. Your best season is not winter. That's fair. Okay. All right. So yeah, in the interest of time, we're just all going to come to the consensus. Spring is the best season. Um, yeah. Pamela, you want to go ahead?
Yeah, okay, so you might have gotten some feelings throughout this whole process. So I'm gonna stop right now and ask these talking points of who has the power in the room?
From the way that we decided to ask and answer the question, and based on the people that we spoke to, who do you guys perceive as having the power?
A majority of the people, like whoever outnumbers the other.
The one who took it and just talked.
Okay.
Yeah, I was
Okay.
gonna say the one that chooses to speak.
Mm-hmm.
Yeah, and there wasn't always like incorporating others, so it was just, yeah. So it was a blend.
Is a blend? Okay. How did it make you feel when you were being excluded from the process? So like some of your guys' answers weren't being incorporated,
On
like
my
say
first one, I didn't get added to the breakout. I was like sent to a breakout session by myself at first. So I actually joined late. So I didn't like want to come in and be like, no, I don't agree with that. Right.
Oh,
I just kind of blended in with it because I came in late.
yeah, and then sorry, Stephanie, we saw your hand up. I did not say that until later, but Stephanie?
I wondered if that was kind of a trick question because at least one thought that I had was no one really had the power because the question and the source came from outside of the groups. And it was kind of like the task that we all had to come together to agree. This is not to be defiant or anything, but I was like kind of thinking outside this, like, well, actually, we're told this is a task that we have to do and it's a question that we have to answer. And it did not really come from us as a group.
Right, exactly. And so it kind of makes me want to make note of, did any of you guys kind of seem like talking about that right now, feel like, Lila and I or had held that power, right? Because we initially we chose on one group. I don't know if y'all noticed that, right? We chose one group and it's pretty consistent. And we kept asking the same group. And then we just decided that that was going to be everyone's consensus was that one group's choice. Um, you know, for the group that did get to report out, how did it feel to constantly be relied on to give feedback and responses?
I was a little confused.
Yeah.
Yeah, I was yeah, definitely curious as to why we were picked multiple times. And then also curious as to the other answers of the other groups.
Right.
Yeah, so I mean, all of the things that you guys are probably feeling and realizing about this activity are very intentional in the way that it was set up. So, like you said, Maria, you said that we have the power because we're the ones that decided to make it a consensus and move on. So that's completely correct. And so that's kind of what this whole activity was meant to exemplify. Yeah, you felt special first, and I feel manipulated. Mm-hmm.
Yeah. I would like to circle back into some primary points of what this whole activity is that oftentimes we are not intentional about how we engage communities. We set up like for example, we set up advisory boards and focus groups to get perspectives that we never intend to use. We see that sometimes, right? And then also we have a responsibility and obligation to be thoughtful and intentional about how we share power even in small instances that don't necessarily seem that important. But remember that it's also easy to call on the same people and put them in a position that they end up being burnt out or stressed out from the responsibility of always being called on. Like, for example, Lila and I had just chosen Section 8 and just said it was just convenient. But in reality, we just chose them because we didn't want to choose anybody else. And that really leaves out the possibility of getting the diverse responses from everyone else in the group. So I hope you were all able to take those key points and learn that from doing this activity. And I mean, I did this activity myself the first time and it was a bit frustrating because there was times where I'm like, hey, my voice isn't being heard. What's going on? Right? All right. So we will go to slide 30 if I can get it to. There we go.
All right. So engaging lived experts, case studies. First, we've got the extended foster care program. This is something that SDMC worked on. So this program, we actually are running a little over. I don't know if you guys noticed, but I'll try to speed things up for you guys. So this program really highlighted how lived experts can guide improvements for youth transitioning out of foster care. And then the family reconciliation services we worked on, lived experience helped shape services that support families in building stronger and healthier connections. So
All right, so the first one, extended foster care program. Extended foster care program, EFC, for Washington State plays a critical role in supporting young adults transitioning out of foster care. The program provides a range of voluntary services, recognizing that although these individuals are legally adults, they still require significant support and stability as they navigate the developmental stage of emerging adulthood. The co-design process involved a collaborative approach where multiple stakeholders, including young adults with lived EFC experience, DCYF staff, and community partners contributed to the development of an assessment and recommendations for the program. This method was crucial in identifying service gaps, barriers to service utilization, and areas for improvement within the EFC system, as well as in making recommendations that are more likely to be effective and meaningful for young adults involved. So I got to be a part of this project that was mentioned with the co-design process. And for me, from my lived experience with EFC, the beginning was very like it was frustrating. I had some adverse experiences because I was homeless at the time, but I was 18, so I had just legally turned into an adult, and I was eligible for EFC if I had been enrolled in school full time and or held a job. However, at the time, again, I was homeless, so my biggest concern was looking for a house, a stable home to live in instead of couch surfing. So I was not meeting the requirements of school because I did not show up most of the time, and I was truant. So, EFC, I did not get the payments, and which would have been helpful for me to save up, some money or go to my basic needs. And I struggled a lot on trying to figure out adulthood while being homeless. So while I was part of this co-design process, I had used my adverse experiences and used that as the driver for change for this example, and and allowed my experiences to help with I can't remember the bill, if Dalilah, you remember the bill name for it. But basically we had gone up to our recommendations had went up to the policy level of changing bill. Do you remember the bill? I'm so sorry.
yeah, it's 5908 Senate
Thank
bill.
you. Senate Bill 5908, which it had re-improved the requirements for people who are entering into extended foster care. And so I'm going to go over the key takeaways here. So youth who are enrolled in extended foster care in Washington have better outcomes than those who do not, including reduced homelessness, higher employment rates, and increased educational attainment. And there are significant service gaps, as I was mentioning, particularly in independent living skills programs and mental health services. Um, and lived experts express the need to revise eligibility criteria to be more inclusive and ensure that youth who are most in need can access EFC services, extended EFC eligibility to age 23 or 25, in which I had aged out at 21, and I did not feel like I was still stable enough to be an adult like at that time because I don't think anybody knows what their life is like. They don't have it figured out at 21, right? I think we can all agree to that. Um, and it's to better support youth as they transition to adulthood while increasing financial support provided to youth and supervised independent living placements to better cover the actual cost of living. And so that's what that bill had helped out. And again, it's to better suit the young adults entering EFC, and it really took out that barrier for people, and it had that barrier was so significant that tons of people had missed out on the EFC. And I think it was if you didn't enroll in the first year, you weren't able to obtain the EFC services from then on. And that really sucked because there was people that really could have used it, but missed out because they something simple as mine was like not attending school, for personal reasons like being homeless, and that was a lack of service for them, and didn't have to be, and so now they're automatically enrolled now. So that's what that Senate bill allows us, the future youth now to once they transition into adulthood. And then the next one.
Yes. All right, so Family Reconciliation Services, FRS, it aims to enhance support for families in crisis. FRS allows families to access services by contracting the DCYF intake line, leading to assessments and home services and referrals. So this project builds on the history of FRS, which has been shaped by significant legislative changes, including the 1995 BECA bill and recent laws promoting cultural responsiveness, trauma-informed care, stuff like that. So in short, it's about updating services to better meet the needs of families today. So this was a collaborative effort to develop a new FRS model that includes input from youth, families, system professionals, and community providers. Through scheduled sessions, the project brought together a diverse group to co-create a model that is effective, inclusive, and community-driven. So just to go over a few takeaways. So the service has been it has seen various legislative changes with significant investments in recent years to enhance delivery and effectiveness. So House Bill 2873 that passed in 2020, it focused on cultural responsiveness, trauma-informed services, and introduced the potential for contracting community-based agencies to deliver family reconciliation services. So the project timeline, it spans from its initiation in January of 2022 to its implementation in June of 2024, ensuring that careful planning and community involvement at every step of the way. For the next one. So community-based family reconciliation services proposal. It was a comprehensive model co-designed to stabilize and support families and youth in crisis through culturally responsive trauma-informed services. So the model uses a team-based approach. Like I said, it brings together social workers, system and community connectors, peer specialists, and program managers to work collaboratively in resolving crises and building long-term resilience. It incorporates a stepped care intervention strategy, tailoring services to the severity of each family's needs from low to high intensity support. And the program is designed to serve about 100 families per site each year, with the broader goal of supporting 2,000 families statewide through phased implementation. So in short, it's a structured, scalable approach to help families get the right support, right level of support that they need the most. And then, so our co-design process really focuses on all three levels of engagement. So at the micro level, we've got individual interactions with direct engagement. At the meso level, we do community design and stakeholder engagement. And then at the macro level, this is where policy and systems change. So.
All right, so here are some examples of activities for power sharing. Now, this isn't just only these ones, these are just some examples. We have journey mapping, and so journey mapping takes a single experience and breaks it down into distinct stages and points of interaction. Lives experts define these phases based on real life timeline, which often differs dramatically from the system's official procedure. And then there's touch points, and these identify where structural barriers or opportunities for harmful experiences exist. Their thoughts and feelings, this adds to crucial emotional cost of navigating the system, so that gets added to the journey mapping. And then there's also pain points. So there are the specific areas where the expert identifies a need for innovative solution-focused intervention. And then conversational cafe promotes deep listening, inclusive dialogue. So key points on conversation cafes are that, again, inclusive dialogue. And there's rounds of conversation while focusing on listening, uncovering deep insights. It's small group focus, and you can take the groups and either have them alternate and switch out in different groups, so they're not just stuck with one group. They're being diverse and sharing their thoughts throughout with everybody. And the output is insight and not action. And then there's civic engagement and advocacy. And so examples of these impacts of the interactive activities are new and innovative programming, legislation, and more empowered community. Here are some examples of journey mapping. Mine's on there. I'm not gonna discuss which one it is. However, you can see that each one of these are different, and that you can see in some of these how there's emotion, right? So one of them doesn't have any words, but you can sense that there's still the emotion through it and the uniqueness, right? And by looking at the one on the right, you can see the pain points and what needs to be changed. And again, this is a great example to take the lived experiences and visualize it, and you can visually see what changes need to be done.
All right, so in terms of support, we have a few retention techniques. So this means continuous support and development. We provide meaningful roles and responsibilities to our lived experts, and we provide them with opportunities to lead. And we focus on removing barriers that they may face. In terms of feedback mechanisms that we engage with, so we have regular check-ins and service evaluations, which include feedback loops and holding space, which there's multiple ways that you could do this, multiple pathways or methods, and to ensure that everybody is able to participate so it's accessible. And then we also adjust our approaches based on the feedback that we are receiving. And then a few key takeaways. So what we hope you guys gathered from this presentation is an understanding of what it means to engage with lived experts, engagement and recruitment strategies, some power sharing activities that we went over, and then a few retention techniques. And then I have a link to a Google form if you guys have any questions, or if there's anything that you guys would like to discuss, you can take the time to do that now. But we are also dropping a Google form if you guys are interested in the co-design process and interacting with Sam. He's really great at facilitating these kinds of conversations. Yeah, so if you guys have any questions, comments, concerns, discussion, anything, we can do that now, or you guys can go ahead and put it into that Google form.
I have a question really quick. And just because, I mean, I think you guys did such a wonderful job presenting. Pamela, I did hear that you said you were young, and Dalilah, you look young too. So I don't know, but you guys did a wonderful job presenting.
Thank you so much.
Wise beyond your years. So I have a question. You guys had talked about being a part of different advisories and different things. Is there a way that anybody has coached or guided you to be engaging during those meetings? Because that is one thing. I mean, I started off as the family voice at the table, and now I help with state level advisories, 3 of them. So to me, my biggest challenge is, I always try to make the families feel heard, and that I'm listening to them, and that, we pay them for being at the table. I think that's one of the most important things. But then in some levels, it's like, I don't know how to make them feel like I'm telling them that I think it's important, and that their expertise is so important, and that, that other people want to hear it, but to get it from them, because we interview them and we think we've got the right people, and then whenever it comes down to it and they're sitting across the table, and it's like you ask questions, or, you want them to help plan the agenda for the next session, the next meeting, and it's just like crickets. I mean, how do you empower them to know that their voice is being heard when you're speaking up? When I'm basically, I mean, I'm not saying I'm doing absolutely everything perfect, but basically I'm doing everything that you mentioned, but sometimes it's still just like, I cannot get them to engage. And I feel like it's a lack of confidence of them feeling like their voice is important, or they don't have the confidence to speak up. And that's where I struggle.
Lila, I can actually speak on this because I am part of DCYF's Oversight Board Committee.
Yeah, of course. And then I have a few thoughts as well. So you go ahead.
Yeah, so when I first started out, because I had just recently been appointed by our old governor before he had left the office last year, I was in that position where I was quiet, and I think it was lacking that confidence for me. This is my personal experience, but I had this great mentor of um Peggy Lewis, DCYF worker for I don't know about 20 years or so. It's been a while, and Peggy really like reached out to me and let allowed me to talk and engage with other lived experts who were in similar positions on me, and that's how I met Sam. And they it was that mentorship of other lived experts that really helped me to gain my confidence and know that I actually have a voice and I can speak. And so now when I'm in these meetings, I am able to present myself and just be me. Like I'm not under assumption that I need to be catering to everybody around me in the table. I am here to bring my experiences, and if it's beneficial for the group, and that's great, I just give my insights. And everyone at the table, like I work with a lot of prestigious individuals like Senator Claire Wilson and uh ex-Justice Supreme Justice Bobby Bridge, those that can be intimidating. I don't know if your board meeting group members, if they have those prestigious titles, but that having a title can like made me feel a bit like, oh, I'm not, I'm not anybody. I'm just me with lived experience. But my whole group really like when I speak afterwards, they make note and go, Pamela, thank you for your shared thoughts. Like that actually means a lot. And Claire does such a great job of in making sure that I'm incorporated and really lets me know that I'm valued. So I'm not saying that you guys don't do that at all, but that was just from my personal experience. But that mentorship really grew me out of my shell, and knowing that there are others around me who are up in higher positions with that lived expert title, but that doesn't mean that that's all you are. You can make a difference by just being you, though. So that was my take on it.
Yeah, thank you so much, Pamela. I'll say on like a broader scale, the way that we can really hone in on like our engagement. So like I said, advisory boards, paying lived experts, we hire lived experts to join our team. We do design surveys. And so all of those things kind of work. So when we get them together and we are in that room, something Pamela touched on is like, Sam is really good about creating a really supportive and empathetic environment. And so if he feels like, maybe you're holding back a little bit, he'll pull you aside and be like, hey, like, is there anything going on? He's done this with me. And I'm even coming in with the perspective of I don't have as much lived experience, but I've got more so the degree side of things. And so whether or not it's lived expertise or, you're coming in with a degree, he does like to pull people aside, talk to them like they're human, have that empathy, and really encourage them to speak. And so, yeah, I think that would be a great question for Sam to answer as well. And I hope this kind of helped you out as well. Okay. Alrighty.
Yes, for sure. Thank you so much.
Yeah.
And I am going to put my email in the chat because this has been so great. And I love it. I personally aged out of foster care. I live in Oklahoma. I started out my experience as a lived expert on a member advisory task force for the healthcare authority.
Okay.
And now 10 years later, I run advisories I do the one for the healthcare authority, and I started one last year for child welfare. And we have a birth families that sit around the table, and we have made real huge system changes, and it is wonderful. So I love it. So thank you guys so much for this. This wasn't even what I was expecting when I clicked on this session. I was thinking it was something completely different because our whole group voted on it. So I'm just so excited that we came to your session. So thank you so much.
Thank you so much. And we're absolutely so happy to have you guys all here. Uh-oh. There we go. All right, if there's nothing else, Pamela, you want to head to the next one?
Yep. Did not change?
Oh, wait, it did change. Oh,
okay.
There you go.
And so I'm going to lead us to the next one after because I'm.
Oh, got you. Okay, so join us in There we go. You guys could rate these ones. These ones are just kind of like our closing slides. Big shout out to Cesar Chavez. He said, we cannot seek achievement for ourselves and forget about progress and prosperity for our community. Our ambitions must be broad enough to include the aspirations and needs of others for their sakes and our own.
And here's the link.
Yep, so this is a QR code. You can follow us on all our social media. I believe this QR code also takes you guys to that Google form that I was talking about. Terry, I will take down your email and I will make sure to follow up with you and pass that off to Sam as well. So I'm going to copy that. All righty, let me get that down. All right, hopefully everyone has had a chance to scan that QR code. But again, if you need it, you can just look in the chat and we've got a link to the Google form right there.
Yep. And here is Samuel Martin right here.
That's the man, the myth, the legend himself. That is his email right there. So his is sam@sdmartinconsulting.com. Mine is Dalilah@sdmartinconsulting.com. So just my first name. A link to his LinkedIn right there, which of course you guys can't unfortunately click. All right.
All right. Thank you all.
Thank you guys so much. And thank you so much for your patience as well and sticking around with us.
Yeah, thank you.
All right. We hope you guys have a great day. Bye.
Bye, everyone.
Thank you.
Thank you.
Thank you.